So if a patient goes to you and they're currently wearing a denture, or you needed a full mouth of extractions, and now they're going to get supported by dental implants, what's the options when it comes to dental implants in your practice?
Yeah. Well, if you want to talk about tiers of options, the first option would be something as simple as maybe 2 dental implants in the lower jaw, or 4 dental implants in the upper jaw, and you could take that denture and snap it on to an attachment piece that screws into the implant.
Okay.
So it still comes in or out, but it's easy to, it doesn't require adhesive. Patients can put it in and it'll be retained with confidence. It'll have better chewing power too.
Okay.
The second option, or in between option, is instead of going 2, maybe you go 4 or 6, and you still use a snap-on.
4 or 6 implants.
4 or 6 implants, and those implants either have individual connectors or they have a bar with connectors, and then the denture snaps onto that. It's very robust, it's very solid, but ultimately at the end of the day, you still have something you're taking.
But you can still eat salads and
you can eat
meat and stuff like that.
Absolutely, absolutely, and eat with confidence. The third option, and what we find is what really everybody wants, is a full set of teeth that are on as few as 4 to 6 implants, that don't come in or out, that have no dietary limitations, that have very routine hygiene maintenance home, brushing, maybe use of a water pick. It most closely approximates the brushing and flossing habits the patients had before they lost their teeth.
Now the upper denture though is pretty good, right? It's snug because of the little bit of suction.
Yeah, you don't wear an upper denture, I take it.
No, no.
I think an upper denture is better than a lower denture, but that's where the favorable comparison stops. An upper denture still has a thick piece of plastic, or what we call acrylic, that covers the roof of the mouth. It inhibits taste, enjoying a good glass of wine or whatever else your palate may enjoy. It takes up space. It's something to get used to. It affects speech for a lot of patients. Many patients will have a gag reflex, and that having that material that covers the entire palate, goes all the way back to the soft palate, which is where the gag reflex starts for most of us, is uncomfortable. It's a hard adaptation.
So you remove the palate completely on the upper.
Correct. When we do these full arch type of prosthetics or tooth replacement solutions, there is no palate. And the thickness of the teeth and the prosthetic gum tissue that goes on these is not much greater than what patients had with their native or natural teeth.
Okay. Now, it's less expensive to get this, as you call it, an overdenture, a snap-in, snap-out set of teeth, supported by implants, right?
It is.
Your competition, the biggest competition, they don't even offer that. But you say not everybody can afford a fixed set of teeth. I'm paraphrasing slightly. Mm-hmm. So this option may be good for certain people.
Absolutely,
right?
Yeah. I think for certain, both from an affordability standpoint, and there may be patients who, outside of just health-related issues with their mouth, they may have other health-related issues. They may have Parkinson's. They may have issues that make a removable prosthesis and the hygiene, the ease of hygiene, may be more favorable for them. So there are some individuals who maybe benefit more from that type of approach.